sending blood to the liver. It goes inside the liver, but we do not allow the blood to go everywhere for processing in the through the hepatic vehicle. We are not talking about hepatic artery. Just understand that this part I want everyone to understand. For any organ, you still need blood for survival. Like every single cell wants blood for survival. That blood is coming to the liver through hepatic artery for survival. Now, the portal vein blood is coming for absorption of the nutrients before it drains through the hepatic veins to IVC. So what we do, hepatic artery is nothing we are doing it to, but for the portal vein, the incoming portal vein blood, we say why this blood has to go to all different liver cells if the cells are not working and they are not going to absorb nutrients or they are not going to help in any way. So what we do, we just create a channel so direct incoming blood is drained into outgoing pathway. So this is what we do, and those are called shunts. There are few different kind of shunts possible when we talk about the liver. So porous systemic or shunting procedure works by creating a bypass around the diseased liver between intestinal blood vessels and normal veins that drain back to heart. Surgical portosystemic shunts are performed to decompress portal system in patients with portal hypertension. So to avoid that pressure inside the portal vein, we just make a pathway. So if let's say this is the liver and this is not working, so if the cells are not working over here, it is just going to create back pressure and portal hypertension. So reduce that portal hypertension, because this portal hypertension finally is going to give complication like GI bleed, and that can be life-threatening from esophageal varices. So to avoid those kind of conditions, we just simply drain this blood outside so it reduces the pressure. And if you remember, there are few ways the body is going to make collaterals to reduce the pressure. But if the body is not taking any step towards reducing the pressure, we put stents from outside, and there are few possible shunts. So common portosystemic shunts, we are going to go over these shunts, but the most important shunt that we use is called TIPS. Anyone from this class has seen TIPS shunt in a patient while scanning? It is not that uncommon. So if you have not seen anything yet, I'm sure within these 2 years, you are going to see at least one patient with TIPS shunting in place. So let's talk about other, but you need to know that this is the most common one you see. So the first one is, it's called portocaval. Please know all these names. Portocaval is portal vein joined with IVC. So directly, instead of sending the portal vein inside the liver, it's directly connected to IVC. It's called portocaval shunt. The next one is splenorenal. It's called Warren shunt. Please know what the name of the shunt is and what it connects. So splenorenal is the distal end of splenic vein is joined with left renal vein. And then mesocaval is using a graft. SMV is joined with IVC. transjugular intrahepatic portosystemic shunt, or also called TIPS. It connects right hepatic vein to right portal vein. So please know all these four names. For the second one, splenorenal, please know that it is also called Warren shunt. So know the names and know what it connects to. The third thing you need to know is where the blood flow is going to be, how the blood flow is going to be. So for portocaval shunt, right outside, so this is how the portal vein is going inside the liver. So right before that, it is connected to IVC. Splenorenal. So the way the splenorenal is, and if I have to zoom in and draw that, spleen is over here, kidney is over here, and we are seeing distal end of spleen. Splenic vein is connected to the renal vein. So now think about the blood flow. The blood flow in splenic vein is towards the liver. This region is porosplenic confluence, this dilated region, and then this is portal vein. There is too much pressure, and that's the reason you have this shunt, right? There is too much pressure inside the liver, so there is a back pressure. The shunt is, I'm going to give green color to the shunt. The shunt is over here. Now you tell me, what is the blood flow direction in portal vein with this kind of shunt, splenorenal shunt? Is it hepatopedal or hepatofugal?
Pedal?
Hepatofugal, right. So the normal direction of the blood is towards the liver in portal vein, but because of the high pressure, it had high pressure inside the portal vein, and to reduce that pressure, we just made a connection over here. And if it's confusing to you, I'll just make it blue in color. We made a connection over here so that the blood can flow through the spleen, but blood can come out from the spleen. And because there is too much pressure over here, and we made this channel, the blood in the portal vein will start coming in the direction of the shunt so that it can drain from the shunt. So, important point about this shunt is the blood flow in portal vein is going to be hepatofugal. I will go back to the slide and I want you to write it over there. This will help you later on when we talk about Warren shunt. When we talk about Warren shunt, the portal vein blood is hepatofugal, away from the liver. Same thing is going to be with this one, and same thing is going to be with this one, hepatofugal. hepatofugal. So first three, hepatofugal in portal vein. Now, how the fourth one is different? Fourth one is inside the liver, the right hepatic vein is joined to portal vein. So the blood is still entering inside the liver. So in tips, the flow in portal vein is going to be hepatopedal.
So
for
just tips is hepatopedal.
correct.
But
Tips is hepatopedal. Yes, go ahead.
in the notes it says exception tips and Warren shunt will be hepatopedal.
I will tell you little more because there is something else to it. When you read the note says in shunt, I believe, but we are talking about in portal vein.
Oh, okay.
Mm-hmm. So right now on this slide, we are specifying the blood flow in portal vein. Now, the next thing is what is going to be the blood flow in shunt itself. So talking about the shunt itself, I will just make correction if I need to bottom there. But there are two things in portal vein. Just look at look at my writing for now, and then if there is anything, I'll change on the next slide. But inside the portal vein, the blood flow is going to be hepatopedal with tips. Now I will draw and explain what it is. So now once it is inside the liver, tips, it's joining inside the liver. So the blood is going hepatopedal, and we are talking about tips. In the portal vein, inside the shunt, within the shunt, it's going outside. So inside the shunt is not going towards the liver, shunt is draining outside. So specifically we say inside the shunt, it is hepatofugal because shunt is draining outside. And same thing is in Warren shunt. Warren shunt is between splenic vein and renal vein. So the direction of the blood is away. So within the shunt, the direction is going to be away in Warren as well as tips. And let me just read and see if I have to. So shunt patency is confirmed by demonstrating flow within the shunt and by hepatofugal flow in the portal vein. So when we talk itself about the shunt, tips and Warren shunt, inside the shunt, it is going to be hepatofugal. So please know that inside the shunt, it is going to be hepatofugal in tips and Warren, but in portal vein, it is going to be hepatopedal in tips only. And I will just write all together so that we know what exactly it is. When we talk about the shunt, there is the first one. Can somebody say the name of all four now? From the previous slide, anyone has slide in front?
Like just read the four listed?
It's correct, yes.
So portal cable side in parentheses. Renal and shunt. So and
Christy, is that you? Somehow
Yeah.
the audio is not coming well. Is there anyone else who can read?
The first one is portal cable. Is that what you're asking?
Yes, yes. And what's the second one?
Splenorenal or Warren shunt.
So portal cable, let's just go over here. I'll just write it over here. Portal cable, splenorenal, mesocaval, and TIPS, 4. So now, when we talk about these four, PSMT, are these the four?
Yes.
Yes.
Okay, good. So let's just talk about the blood flow in portal vein and the shunt. In portal vein, what the flow is, and in shunt, what the flow is. So when we talk about the portal vein, inside the portal vein, if the shunt is, what's the name of the first one and what it connects? Anyone?
Portal cable.
Portal to IVC?
Yes.
Okay, portal to IVC. So because portal is connected to IVC inside the portal vein, you are going to see hepatofugal. It's not going towards the liver because now outside it is connected to IVC. The second one is splenorenal. Is that the one?
Yes.
So splenorenal, it's not going inside the liver. Before the liver, it is connected to renal. So you are going to see hepatofugal in portal vein. The third one is mesocaval, where it is connected to SMV, is connected from outside to IVC. So for here also, it's going to be hepatofugal, and TIPS is the only one. It's connected inside the liver. So the portal vein is still bringing blood inside the liver. So it is going to be hepatopedal towards the liver. Yes? When we talk about the shunt itself, the shunt itself is basically, we don't talk too much about whether it's away or it's away from there, but mainly we talk about the last two one. And out of these two also, the most common one we need to know, the last one, the TIPS, that inside the portal vein, it is bringing towards the liver, but once it is inside the shunt, it is exiting the liver, so we call it hepatofugal. So these are important to know. So know these four things. When we talk about portal vein itself, it is hepatofugal, hepatofugal, hepatofugal. And when we talk about the shunt itself, over here we call it hepatofugal, and we don't talk too much about how the shunt is with the first two ones. And on top of everything else, over here in USA, unless and until there is some other indication to use another shunt, we usually go by the last one, TIPS. So please know the last one, how the blood is going to be in portal vein and how the blood is going to be in shunt. TIPS is the only one that is connected inside the liver. So the portal vein has to bring blood inside the liver.
So just to clarify, Femi, the notes do have it written as hepatopedal, so we should cross that out.
Which one?
It says that TIPS and Warren shunts will be hepatopedal, so we should cross that out.
Yes. Wait a second.
It's on the slide.
Okay, first of all, did you all take this notes and then I'll go to that slide?
Yes.
Okay. So let me just go to that slide. Exception, TIPS and Warren shunt will be hepatopedal. Yes. Please cross this out.
So all of the shunts are hepatofugal, but the only portal vein that is hepatopedal is the TIPS.
Yes. The first two we do not use over here often, so we do not go in detail, but over for TIPS, that is very important to know that TIPS is the only one that is bringing blood towards the liver in portal vein. And once it is inside the shunt, it becomes hepatofugal. So as long as you know mainly about TIPS, you are all set. And this is over here from this image, that TIPS is extremely clear. So how this, it's a unique appearance of TIPS once you take the picture inside the liver. It's a very unique appearance of TIPS. So what you are going to see that in main portal vein, the direction is towards the liver. So it's entering inside the liver. So we call it hepatopedal in main portal vein. And as soon as we have shunt inside, it is draining into IVC. So not IVC, the right hepatic vein to be specific. So it is draining towards right hepatic vein. So inside the shunt, we call it hepatofugal. Because the moment it enters inside the shunt, it's going towards the drainage side. It does not stay inside the liver. So in portal vein, hepatopedal, inside the shunt, hepatofugal. And as I'm saying, TIPS is the only main one we use over here. So the registry is mainly usually they test on TIPS. For others, they go by different names and they usually ask for which one connects to which, but the blood flow, they usually test on TIPS. For other one, if it says Warren, they might say which one is connected to which. And if it is the other two, they say which one is connected to which. But direction-wise, you need to know about TIPS. Am I making it clear? And other than TIPS, if you have to, instead of memorizing which one is hepatopedal, which one is hepatofugal, instead of thinking about that, I will tell you why they do not talk too much about hepatopedal and hepatofugal with others. Because when we talk about other three, they are usually connected outside here, like either IVC to splenic or splenic to renal or this. So usually we do not relate it to blood flow from here, but TIPS is the only one that is entering inside the liver. So we talk about hepatopedal and hepatofugal inside the shunt. And if we talk about the blood flow in the portal vein, TIPS is taking it inside and the other ones are taking it away. So if the question is asking for the blood flow in portal vein, only TIPS is going to be hepatofugal and others are going to be, TIPS is going to be hepatopedal and others are going to be hepatofugal. But when we talk about other shunts, usually there is no logic of whether it's going away from the liver or towards the liver, because they are connected outside the liver somewhere over here. They are not connected directly to the liver. Does it make sense to everyone? So if I did not hear yes yet, I will go over quickly for 1 more minute probably. So when we talk about hepatopedal and hepatofugal, it means away from the liver or towards the liver. So when we talk about this structure over here, we can talk about whether it's sending towards the liver or away from the liver. But when we talk about the shunt itself, splenorenal is somewhere over here, SMV to IVC somewhere over here, portal to IVC somewhere over here. So on those shunts, they are outside the liver. So usually we do not talk about whether they are towards the liver or away from the liver, because they are in the different direction. You see that? But we can talk about the blood flow in portal vein. Blood flow inside the portal vein is only hepatopedal with TIPS, and it is going to be hepatofugal with others. So it's a logic that TIPS is taking it this direction and all the other shunts are outside. So the portal vein is going to have this direction of blood with others, because the drainage is somewhere outside the liver. So yes, cross that last line and understand the logic. So this is over here. Again, going back to very quickly so that you don't forget, because this is usually a question everywhere. Now you tell me, what is the direction in portal vein with TIPS? Very good, hepatopedal. What is the direction of blood in TIPS? I'm not saying in portal vein, I'm saying in TIPS.
Hepatofugal.
Very good, hepatofugal, very good. So it's going outside because it's draining from here. This is the typical appearance you are going to see if you take the transverse image. And whenever you see in transverse image, whenever you can see right hepatic vein, you are going to see echogenic borders. It's kind of a ribbon type of border you are going to see from TIPS. So 2D appearance of TIPS is something like this on right hepatic vein. Please know TIPS is connecting right hepatic to right portal. This is another typical appearance you are going to see. Remember, many of you, I scanned liver with you, and I said, if you are not able to get liver from front, you can always go on side, and you can always do intercostal, especially while looking for portal vein, and especially while I was going over on CBD with many of you, there was a location on the side between the ribs I showed you. So through that location, you are going to see this red color portal vein and blue color tips if tips is present. So that's a typical location of looking for tips. And then this is another one where you have tips. You have to scan tips just to look for occlusion that might get occluded at some point. So that's very important study we need to know. This is right hepatic vein. This is the waveform. So in main portal vein, you are going to see towards flow. So it's above the baseline. And in tips itself, you see away. So it's bottom baseline. And then if there is any kind of stenosis or narrowing in the tips, then you can get the waveform right after the narrowing, and you are going to see extremely high velocities. Over here, you are seeing the velocity of 168 centimeters per second. So it's a high velocity there. So high velocity is talking about telling you that there is a narrowing or post stenosis. There are different locations where you have to get the waveform when the patient has tips. So inside the body, technically this is how the tips is placed. The portal vein is entering inside the liver, and at the entry point, the right portal vein starts, and there is a shunting from right portal vein to right hepatic vein. So there are few points where you have to take the waveform, and if I zoom in, you have to take the waveform in main portal vein. Then before the starting of the shunt, inside the shunt, you have to have at 3 places: proximal, middle, distal. And then after the shunt, you have to take the waveform in right hepatic vein. You have to take waveform on the other side of right hepatic vein also. And then you take it at IVC. Because it's a shunting, you have to take the waveform in right portal vein as well as left portal vein too. So there are multiple locations where you have to take the waveform with tips. So when you see this, it's mandatory or circles, optional or square. So over here, IVC is optional, but many labs, they do IVC also. Any question on tips or shunting? Okay, this is the last topic, passive liver congestion. The name itself is telling that it's the congestion there inside the liver. Passive edema of the liver secondary to vascular congestion is a complication of heart failure. So passive liver congestion, it's usually coming from heart failure. Blood exiting the liver must pass through hepatic veins and an IVC before dumping into right atrium. So if there is anything wrong with the right side of the heart, there is going to be too much pressure inside the liver, and we call it like under the congestion category. Resistance to the flow will occur when condition increase pressure within the right heart. This result in passive liver congestion. What it is going to do, this results in dilatation of hepatic veins and IVC due to congestive heart failure. Passive liver congestion is common if the patient has a history of congestive heart failure. Clinical and lab data is going to present dilated jugular vein because there is too much pressure in the venous part. And liver function tests are usually normal with passive liver congestion. Sono appearance. Sono appearance in acute cases, the liver becomes decreased in echo texture and increased penetration. In chronic, liver will shrink and the veins remain dilated. So this is about passive liver congestion. So mainly we need to know that passive liver congestion usually comes from congestive heart failure. Any question on any of these? Okay, anything you want to ask me? And I'm not sure what was the confusion you had, but when I'm sending you something related to abdomen, all dates are about abdomen. So I said abdomen quiz is on 3rd, and then abdomen, and then midterm is this day, review is this day. So I'm not sure what was the confusion, but some students got confused. I believe the reason is that on calendar it says cross-sectional on that day, which is understandable. But please understand that midterm is not something I would prefer you to do remotely, because midterm is going to be a big exam. So I prefer you to do it in the school, and that is why I left it on 12th. So I asked Carrie about that 12th, and 12th is the midterm. And on 3rd, I have quiz, and I think Carrie also has quiz. So I'm making my quiz open book for you so that you don't have too much pressure on one day. And the midterm review, I will keep it on 10th. And the reason is this is not going to be those kind of reviews where I give you the points and you go over and study those points. Please understand it is registry subject, and this is the time you should really learn everything. So review means you study everything before the review, and when I go over the concepts with you, then you know what I'm talking about, and this should be a review for you also. So you are reviewing what you studied on your own. So review is going to be on 10th of November. Any question? Okay, if you do not have any question, then you may leave, and I will see you on Friday.
Thank you.
You're welcome. Bye.